I'm here at goPhysio today with Clinical Director Paul, and Paul's going to tell us a bit about trigger points. So Paul, what exactly are trigger points?
Trigger points are areas of high tone within a muscle. Basically, a muscle normally contracts and relaxes, but these muscles, when they become triggered due to repetitive activities or postural biomechanical asymmetries, end up with a slow background continuous contraction. So normally the waste products of contraction is removed in the blood supply. However, with trigger points, they linger in the area, stimulating the nociceptors, the pain receptors, causing pain. And they're very common, and they form a part of most injuries we see. So they're so common, there's even posters about it, trigger point pain patterns, and they can basically, if you come in closer, you can see here, let's say on the trapezius muscle, the X is where you traditionally would get spasm, and the red can be the pain distribution. So they refer pain into different areas, and that's a common one we see causing headaches up in behind the eyes. Another common one we see along the shoulder blades is in the rhomboids muscle. This muscle here, the X is the spasm, the red is the pain. Very common again in levator scapulae after whiplash. But all of them, we see on a day-to-day basis. Piriformis syndrome, that's a big one we see with people with pain in the buttock and gluteal area, or even referring down the leg with the gluteal minimus muscle. I've seen cases of people coming in with sciatica, but it actually being purely trigger points. So, from a physio point of view, when we assess someone, we're looking at all the different tissues, looking at what may be causing certain pains, and we use a whole variety of treatments to treat them.
Okay, and what sort of treatments can you use to help trigger points? Well,
basically we're looking at really normalising the tone, so any of your sort of manual therapy techniques such as massage, that can be deep tissue massage or can be myofascial release. In parallel with that, we would look at using acupuncture, myofascial acupuncture, that can help switch off the nerves and relax the tone. In parallel with that, then we would give patients exercises to both stretch the tight spasm muscle, the trigger point, but also to help build up the muscles around it, and look at ways of treating the cause, the postural asymmetries, and preventing reoccurrences.